One of my favorite stories that I like to tell about physical therapy is I had a pediatric patient who had been hit by a lawnmower, and the lawnmower cut the back of his leg almost completely off. So they did a procedure where they flipped his calf muscle down to take up that space. So I started working with him, and then months later, his mother brought him back and said, oh, he started playing Little League. And then years later, my son came home from school one day and said, hey, do you know this kid named so-and-so? He's one of my friends at school. And he said that he was hit by a lawnmower and that if it wasn't for his physical therapist, he wasn't be able to walk. And he goes, that therapist was you. And I'm like, what? Oh, that's wild.
Welcome to the Care Chronicles with a Caring Touch, where compassion meets wisdom in every episode, dedicated to our beloved seniors and caregivers. Join us as we explore the heartwarming stories, experts' insights, and practical advice that make every moment with our elderly truly special. Get ready for insightful conversations, practical tips, and heartfelt moments that warm the heart and nourish the soul. Because here at A Caring Touch, we believe in laughter, learning, and love as essential ingredients to aging gracefully. So tune in, relax, let A Caring Touch be your guide to making every moment count. Hey there, podcast pals. Welcome back to another episode of the Care Chronicles. I'm your host, Davishka, and today we're joined by one of our well-loved physical therapists, Charles Libby. Charles Libby has over 30 years of experience and is currently serving in the Houston area. He has helped patients of all ages regain strength, flexibility, and confidence, and has over 30 years of experience. Welcome, Mr. Libby. Thank you for joining us. Let's get started with what inspired you to pursue physical therapy and specifically in the home health sector.
I started my career as a certified nurse's assistant, a CNA, right out of high school. And back then, they would call us orderlies. So I always wanted to help people in some capacity. I eventually went to college to pursue a career in psychology and then changed my direction a little bit and started to work with athletes, primarily in sports medicine as an athletics trainer. And then from there, continued to try and increase my experience and knowledge and became an EMT, and then got a master's in exercise physiology, and then decided to try and find another way to further that endeavor and became a physical therapist. So it allowed me to do all of those things that I wanted to do. But the reason why I chose home health, and I used to work with agency that provided all of the home health care for Memorial Hermann here in Houston. And so I covered every type of facility they had and every situation they had whenever there was a need. And so my skills had to be on point and everything I had to be flexible enough to basically acclimate to any type of situation and environment, any age, any patient. But home health allows me the blessing of having a one-on-one interaction with my patient for the given time that I'm allotted within their environment.
That's wonderful. I know a lot of your patients, speak very highly of you. They love the interaction. They love that one-on-one communication that they get with you. So
Is because they can see that I enjoy what I do and that I truly care about them.
yes, that's very true. So I know you said you worked with Memorial Hermann and, all the other factors in like hospital settings and facility settings. So how does that differ from home health? A patient getting therapy in an outpatient facility in a hospital versus a patient getting care in their own home?
That's a good question. And it has multifacets, but primarily each one of those other settings have a different goal in mind. For example, acute care, it's just to get them to a point where they can be discharged to a step down facility where the next goal would be to look at the goals are just different. In home health, the goals are very specific because it's related to the safety and independence that they require to maintain their current living situation or get back to their living situation where they're at their home.
Yes, that's very true. So walk us through like what a typical day would be like for a home health physical therapist.
Well, first, you have to make sure that you are taking care of yourself with adequate night's rest and some adequate nutrition. Make sure that your car has enough gas and
Very
that
important.
following all of the license and registration and everything before you embark on the trail. But really, the day begins the night before in regards to preparation, looking through notes, catching up with any changes in the plan of care that might have been initiated by any of the other disciplines. And that's the thing, too. We utilize an interdisciplinary approach here where the social worker, the nurse, OT, the case manager, the chaplain, any of those people have an open line of communication. So incorporating all of that information, basically establishing the logistics of where they are, how you're going to get there, trying to work in how Houston traffic plays into it, all of those little
Oh,
things.
that's true.
Then basically establish your ability to go to sleep the night before without worrying so that you can get up fresh and ready to hit the ground running the next day. And then, depending on how you planned, it should just go like clockwork. Basically, driving to get to my patient, and then from there, initiating the visit with the standard vital signs, checking to see how they do. We utilize something called a SOAP note. SOAP is an acronym for Subjective, Objective Assessment and Plan. So, objective, basically, when I get there, is what they tell me. The objective is what I do and how I measure that. And then the assessment is how they did. And then the plan is what I'm going to do next. So, that's a daily visit. And you just go until you're done for the day. As many patients as will let you come. Some are early risers, they have been their whole life. Some like to stay up late. They don't. The favorite time in home health physical therapy for an appointment is 10 o'clock in the morning. So
Wow.
everybody asks for that.
Hot commodity right there.
It is a hot commodity.
Wow, that is I didn't know that. I mean, I could see that if you're staying up late, if, waking up early, you do your morning routine, and then you're like, okay, 10 o'clock, I can have someone over. Or you're waking up late and you're like, okay, I'm ready now. So let's
Correct.
get started at 10 a.m. I could see that. So whenever I know you're going to see multiple types of visit, and I know you said typically there's a subjective and an objective assessment. Is that following for all sorts of evaluations? Does it differ based on like the start of care, depending on the initial evaluation, depending on the regular visit? How does that pertain to the patient?
Right. So when it comes to the initial assessment, basically there's a medical diagnosis, say congestive heart failure or chronic obstructive pulmonary disease, CHF or COPD. But then there's a physical therapy diagnosis. So I have to incorporate any underlying etiology into whatever it is they want to accomplish within the home. So CHF or COPD, they're going to be short of breath. We're going to have to use the supplemental oxygen, either a safety issue in regards to their evaluation to make sure that they're understanding all of the precautions associated with the use, and then determine whether or not indication to try to wean off of it versus some of the other ones that might be related to diabetes, recent amputation, or a wound, or lymphedema, or stroke. That's the interesting component of working within this environment is you have to wear a lot of different hats. So when it comes to that type of thing, you never know what to expect when you go into somebody's home. So you have maybe 3 dogs, they're taking care of their grandkids. One of them wants to become a therapist or at least a nurse or something in the medical field. And so they're curious. And it has a lot to do with your presentation. The majority of the time, or one of my favorite scenarios, is when great grandma is there and the grandson, the husband, the wife, the great grandkid, the grandkids there, and they're all watching you. They're like,
No
you
pressure.
gonna do to my grandma? And I'm like, okay, let's see here. Let's start off with, the simple stuff, right? Regular assessment with your regular vital signs, and then go, vision, hearing, skin, pain levels. Are you eating good? Are you drinking enough fluids? Bowel and bladder working like it's supposed to? Are you having pain? Right. And then we start getting with, so what happened? How did you get to be into this state? What were you doing before? And then, have you had therapy before? And that's another big one, is they have preconceived notions as to what therapy is. So like, oh, here he is. The guy's going to torture me, right? He's going to make me hurt. And I'm like, well, if you have a total hip replacement or a total knee replacement, you are going to have pain because you just had surgery.
Yeah.
Yeah. So
Regardless.
yeah, that's a given. So take care of it ahead of time. Take your pain pill in a timely fashion, get the ice out, and just do everything I tell you, and everything will be all right.
That's amazing. And I know you mentioned you work with like other disciplines too, right? How does it factor in like working with, I know in home health, there's speech therapists, there's nursing, there's aides, medical social workers, other therapists like occupational therapists also play a part in, helping this patient become non-homebound anymore and take care of themselves on their own and be independent and return to that status that they were at before the surgery or this diagnosis or whatever happened. So how do
Uh,
you work with other disciplines?
It's like having an extra set of eyes and an extra set of hands, and then an extra head. And they always say two heads are better than one, and it's true. The ability to get another person's perspective is critical in getting the true picture of what's going on there, especially from the social welfare standpoint or social worker standpoint, because there's a dynamic that a lot of people don't consider, and the chaplain as well, and whoever is doing the psychosocial aspect of it, where in order to heal in expedient fashion or in a regular fashion, they have to have the right mindset. And that's part of it. The family interaction or dynamics plays a huge role in it, their economic status, their nutritional status, all of those things. And when it comes to occupational versus physical, our goals are pretty much in line with each other, except our approach is a little bit different. So, for example, say bathing. Yeah. My intent or focus would be on working on their strength and endurance and balance so that they could get in the tub or in the shower, stand there, and then get out. The occupational therapist is more focused on the fine motor skill of, how do you take off your clothes without falling down? How do you wash your hair and scrub your back? And then how do you dry off and get your clothes back on? So the goal is to get independent shower bathing, but the focus is a little bit different. And then you can get some cues like, hey, did you notice that in the morning she's really groggy? She's got that sleep hangover. And like, yeah, yeah. In the afternoon, she's always on. She's never had a problem in the afternoon. And so those little feedback can, like, oh, that they found out that her son got a DUI. So, she's kind of upset and probably won't be doing too much today. And so all those little subtle nuances behind the scenes, and the ability to get to know our patients more than just a patient in a treatment paradigm that we're using, is always beneficial.
And it sounds like, speaking with other disciplines, it's very important for the success of that patient overall. Because all of these factors that you don't even think of, at least for me, myself, I wouldn't think of the social aspects really factoring into a physical therapy assistance or help with improving your physical strength. So that's very eye-opening.
There are a lot of other variables too that once it's brought to my attention, then I notice it a bit more. Like when you get a new car, like everybody has that same car as you. But for example, in group home setting, right? I had one person transfer from one to another and just started to decline. And we're like, what the heck's going on, right? Nothing much has changed. Brought over some of the same personnel. The diagnosis didn't change medically, but when he transferred to another one, he started to thrive. And it's like, what the heck happened there? it was because of the socialization. He went from being one of two people to one of 10. So everybody's having dinner, talking, interacting with each other, and just being part of that just brought him out of his shell and started thriving again. And so little things like that, it's amazing. And it wasn't until the caregiver brought it to my attention, like, did you notice? Man, he's like a totally different person now. I'm like, I did notice now that you mentioned it.
Yeah.
Didn't attribute it to that though, but I'm glad.
Going along with that, can you share any stories that have really stuck with you with your home health physical therapy journey?
There are quite a
Sure,
few.
there's so many.
So I think it has to do with not just the length of time, but the intensity with which the relationship was established. Because I think when it comes to amputations, amputees per se, where they were active before and now they're not, they not just lost a part of themselves here, but physically and literally they did. And so to have somebody go from having pain, having a wound healing, to having other medical issues associated with that, to getting a prosthesis and then walking again, and then driving again, and then going to their granddaughter's wedding and walking them down the aisle. Now, those types of stories are not uncommon. You hear good stories just as well as you hear bad stories when you think, oh, that's the most horrible thing I've ever heard in my life. And then the next week you're like, man, I thought that person had it really rough. That's even worse than that. You had the, necrotizing fasciitis or the flesh eating virus. And now, you had a skin graft kind of thing. Yeah.
Yes. What's one thing about physical therapy that people might not realize that's in the home setting versus outside? Something that they can expect?
I've worked with patients from the age of about 6 months to about 103, 104 years of age. And one of my favorite stories that I like to tell about physical therapy is when I had a pediatric patient who had been hit by a lawnmower, and the lawnmower cut the back of his leg almost completely off. So they did a procedure where they flipped his calf muscle down to take up that space. So I started working with him. And then months later, his mother brought him back and said, oh, he started playing Little League. And then years later, my son came home from school one day and said, hey, do you know this kid named so-and-so? He's one of my friends at school. And he said that he was hit by a lawnmower and that if it wasn't for his physical therapist, he wasn't be able to walk. And he goes, that therapist was you. And I'm like, what? Oh, that's wild.
Wow, that is wild. What a small world.
True that. True.
Yeah, that's amazing. Wow. Thank you for joining us on this heartwarming journey with a caring touch. Be sure to check out our website and connect with us on social media for more stories, resources, and ways to get involved. We're excited for you to join us again in our next episode, where we'll continue to explore the beauty of aging with grace and compassion and dive deeper into topics that matter to our elderly community. Until then, stay connected, stay caring, and we'll talk to you again soon on the Care Chronicles with a Caring Touch.